Good evening, ladies and gentlemen, and welcome to tonight's Wound Care Today Facebook Live. A massive thank you from myself and Sarah for joining us. We're well aware how busy you are, so thank you for your commitment to Wound Care Today and tonight's event, which is called Avoiding Incisional Care Complications, a New Animated Way to Learn. And our fantastic speaker who's with me now is Sarah Carvajal. Good evening, Sarah.
Hello, good evening. It was a pleasure to collaborate with Microworld in this module covering incision care.
Oh, thank you, and thank you for joining us. It looks like you're at home. The weather's much nicer than it is here.
It is. I'm in Lisbon, and the weather is gorgeous. It's too hot, actually.
I'm now going to be slightly envious for the rest of this event. Ladies and gentlemen, as you can see, Sarah's from home, so if we have any technological problems, please bear with us and we'll sort them out as soon as possible. The link for your certificate of attendance will be made available towards the end of tonight's event, that counts towards CPD and revalidation. And all the slides, the entire event will be available for download at our website at woundcare-today.com. As Sarah would agree, the more involved you are, the more engaged, the better it is for the event and for her. So please let us know where you're watching from. Please ask questions and we'll endeavour to answer as many of them as we can towards the end of tonight's event. Microworld was set up to inspire, to educate, to delight healthcare professionals around the world who share our passion for wound healing. It's now translated to 7 different languages, and we try to build something that's modern, exciting, and accessible. Rather than me bore you to tears by talking about it, I'm going to hand you over to my amazing digital team who are now going to play you a little video that hopefully will bring it alive. Thank you, Henry. Thank you, team. As you can see, this is our 5th module. We've done stuff on wound healing, exudate management, infection control, moist, and now incisional care. Please go and have a look. mymicroworld.online is the website. Go and register, have a look at the modules, play some of the games, get involved, and please let us know your thoughts. It's your comments that help drive us make decisions on how we can improve in the future. Before we start tonight's event, a massive thank you to our global educational partners who are Mölnlycke. Without your courage, trust, support, and belief in this modern, unique educational platform, Microworld would not exist. So a massive thank you from me, from the team at Wound Care People and Get Animated. It's massively appreciated. So without further ado, it gives me great pleasure to hand you over to tonight's speaker. Over to you, Sarah.
Thank you. So let's start talking about incision cares. This subject is many times ignored by surgeons, but is very important to patients. So this class will cover some types of surgical wound closure, preoperative preparation and risk assessment, and their role in wound healing outcomes. Also, we'll cover postoperative complications and the role of wound dressings play in protecting the wound during all this healing process. Also, we will remember some signs and symptoms of surgical site infection. So, what types of wound closure do exist? This is the most common way of wound closure. It is the simplest and also the fastest to heal. It is primary closure, or also called as healing by primary intention, and it refers when wound edges are close to each other, so approximated. The second type of wound closure is secondary closure or secondary intention. And this happens when the wound edges are not in contact. So the wounds are left to granulate from the bottom up. This is what happens in hard to heal wounds or chronic wounds like venous leg ulcers or diabetic foot ulcers. Finally, the third type of wound closure is delayed primary closure. So this is a mix between the primary and the secondary closure. This happens when primary closure failures due to dehiscence, infection, or any other complication of the wound. So the closure is delayed. When this happens, you have to initially cleanse and debride and take care of it, and it elongates the time until final healing. So this next slide highlights the importance of preoperative preparation. We have to start thinking of incisional care even before the incision is made. Prior to surgery, the patient will undergo a phase of preparation and evaluation of potential risks. So, how should we prepare our patients in practice? We have to make sure our patients understand the surgery. Also, we have to advise the patients to exercise, to reduce or stop smoking. It is shown that stop smoking for 2 weeks, it makes a difference in wound healing. Also resolve any other conditions like anemia or malnutrition or other predisposing conditions that the patient can have. This careful preparation can really minimize anxiety and improve the wound healing outcomes. And remember that there are a number of tools you can use, depending on the type of surgery, to identify patients that are at risk. Moving to the next point, post-operative complications, something that no surgeon or patient ever wants to hear about. So surgical site infection, or SSI, is defined as a type of healthcare-associated infection in which a wound infection occurs after any kind of invasive surgical procedure. SSIs can have a significant effect on quality of life for the patient and is associated with considerable morbidity and also extended hospital stay. Besides infection, we can have complications like surgical wound dehiscence. This means the breakdown of the suture margins, which may or may not be associated with infection. Opposed to dehiscence, we have hypergranulation. This is an excess of granulation tissue, which goes beyond the height of the surface of the wound. In addition to hypergranulation, we can have problems with scarring, like keloids or hypertrophic scars that can be a long-standing problem for the patients. These problems with scarring usually happen in burn and when something happened with the wound, sorry. And also, we must acknowledge and recognize medical adhesive-related skin injuries, usually called MARCs. These are caused by dressing changes and can cause blisters or skin stripping, and this can lead to pain and discomfort for patients. Finally, we have complications like seroma and hematoma, probably much more frequent, but also less serious most of the time. So let's now turn our attention to some facts and figures so you can understand the relevance of this matter. 20% of all healthcare-associated infections are SSIs, surgical site infections. And on the patient and surgeon perspective, as much as 5% of patients undergoing surgery will have an infection. And some studies say this number can go up to 1/3 of patients. So it's a very high number. It's a big problem. And we should also bear in mind that these infections usually occurred in hospitals, in hospital wards, but now, due to one-day surgery, all the fast tracks like ERAS programs, they are coming out of hospitals into primary care. So everyone, even professionals working in primary care, have to be aware of this. Also, take note that SSIs can range from a simple wound discharge that does not need antibiotics and barely affects the patients, up to a life-threatening condition with sepsis, needing broad spectrum antibiotics and ICU admittance. Moving to the next point, what are the risk factors for SSI, for surgical site infections? First, we have a few of patient-related risk factors like advanced age, gender. Some studies point that women can have more risk than men. Severe underlying illnesses, diabetes, surgeries due to trauma, also high body mass index, on the other hand, malnutrition, also history of smoking or alcohol or substance abuse, and also wound classification, as we'll go over in a few slides. On the other hand, we have some procedure-related risks, like the duration of the procedure, increased length of the procedure increases the risk of SSIs. On the other hand, minimal invasive techniques that are all nowadays are all over the place, reduces the risk. Smaller incisions are less prone to have SSIs. Also, the skill of the surgeon and the surgical team, better trained, fewer complications. Also, the surgery is performed as an emergency. This increases the risk of SSI. The use of implants also increases the risk, and also the type of hospital where the surgery occurs. As I already mentioned, there is a surgical classification called Altmaier wound classification that categorizes surgeries according to contamination, and this relates to probability of surgical site infections. As the classification divides the surgeries in clean, contaminated, dirty, or infected, with increasing percentage of probability of having SSI. And why is this important? This knowledge will help you identify the risk of a specific surgical site infection in your patient, and bearing in mind this, the frequency of wound assessment that your patient will require. Please take into account that the signs and symptoms of inflammation can be very similar to infection. And in the first 48 hours after surgery, it is very unlikely that the signs of inflammation are a surgical site infection. What recommendations for cleaning the surgical wounds? This should be made only if necessary. Otherwise, if the dressing is clean, just leave it in place. But if necessary, like exudate leakage, it's recommended that sterile saline is used for wound cleansing in the first 48 hours. After this, just regular potable tap water or showering water are appropriated to clean the wounds. And also, very important, patients should not expose their wounds in the first 48 hours. But after this, they should be reassured that it's safe to shower. Again, as I mentioned earlier, complications like SSI and surgical wound dehiscence are very common. So it is very important that the type of wound care you provide to your patient is based on the risk assessment undertaken before the surgery starts. And we all know post-incisional care can and will vary according to region, and sometimes even hospitals very close have different policies. And we know healthcare systems across Europe have different policies to post-incisional care, but the focus should always be on reducing the risk of infection and its complications. Very interesting. According to Morgan Jones, these are the 6 key features of the ideal dressing. So we want to choose a dressing that is flexible, that is well fixed, that is absorbent, protective for your wounds, waterproof, so the patient can shower. This is very important for patients, and also eliminates dead space between wound and dressing. So when we use a dressing, we want it to prevent contamination and also ensure optimal healing. The requirements from wound dressings may vary according to the type of wound, but they all should prevent contamination from outside, maintain a moist environment that is optimal for wound healing, as we all know. Also allow patients mobility, it's very important. Stay in place for as long as possible, up to 1 week or even more. When the risk of infection increases, we should aim for more advanced dressings to absorb more fluids. Also, make sure the dressing allows for visibility of surrounding areas for we can monitor the signs of infection. And again, be flexible, absorbent, and waterproof. If the risk of surgical site infection is very high, like for example, in open colorectal procedures, maybe you should consider using closed incisional negative pressure wound therapy. There is increasing evidence that this may be the right way of dealing with these wounds. Keep in mind for your daily practice that wound assessment should include the color of the incision and scar. Also, the color of the incision can progress from red with approximated edges from days 1 to 4, to bright pink from days 5 to 14, and then to pale pink days 15 up to 1 year. And also keep in mind that scar tissue in a light-skinned people will have white or silver scarring, while people with darkly pigmented skin will progress from pale pink to darker than usual skin color. So I hope this presentation has sparked your curiosity and motivated you to further explore the incision care module and its potential applications on your daily practice. Thank you.
Thank you, Sarah. And thank you everyone for your comments and kind words, much appreciated. As Sarah was saying, for more information, please go to mymicroworld.online. There's the whole incisional care module, which you'll find there as of this morning. You'll also find wound healing, wound infection, exudate management, and moist. So get involved, register now. We've also got a number of games, and I'm aware that people have started getting very competitive with regards to the games. Our new one is also out today. So go and do the modules, play the games, get involved, and let us know what you think. The modules on Microworld count towards CPD and revalidation. As we said earlier, over 5,000 people have now registered, so please join the fun. So thank you. So Sarah, if it's okay with you, I have some questions that have come through.
Of course.
Okay, I'll start with them now. The first one may be the longest question we've ever had, so bear with me. If factors that may delay healing are identified for a patient in the pre-surgery assessment, how does addressing them ahead of surgery influence wound healing? For example, if a patient stops smoking ahead of surgery, how will that impact on their healing outcomes?
Okay, so as I mentioned on the presentation, it is shown that in many studies that preoperative smoking cessation for 2 weeks before the surgery can improve wound healing and lower SSI and also surgical wound adhesions, essential due to improvements in oxygen flow to surgical sites. So we have like a fairly amount of evidence supporting this. Also the same with exercise, and also the same with blood sugar control. So when the patients ask me, and it's a very common question, what should I do previous to the operation? What can I do to help I always say very clearly, stop smoking, exercise, and make sure you take all your regular medications. They aim for an answer regarding food or something like that, but this is the thing you have to say to them. Stop smoking, exercise, and make sure you take all your regular medications. This is my punchline.
Brilliant. Thank you. Question 2. What are the properties of a good wound dressing for managing a closed incision?
Okay, so once again, I would like to state again that good adhesion, good absorption, and also be comfortable for the patient. Of course, to achieve this, the dressing has to be flexible and also waterproof. Showering is a big deal for the patients. Most of them, this is a recurrent question. They all ask, when can I shower? So it's very important to be waterproof to make sure the patient is happy with the dressing. When you guarantee this, you can tell your patients that it's safe to leave it in place for at least 1 week. And this is like what you want to aim. Of course, it's not possible in all the patients, all the wounds, but it's what we should aim.
Fantastic, thank you. Question 3. Are there any subtle signs of wound infection that are more difficult to spot than the normal cardinal signs, or any patient groups in which affection may be less apparent?
Okay, so sometimes you can have some signs in the blood analysis that the patients have when they are admitted. For example, sometimes increased white blood count without increased protein C, reactive protein, can indicate you have an SSI. Also, low-grade fever. And also you can have some kind of wound discharge without any associated signs of inflammation. This happens more frequently than we thought. Also, and this is a thing here in Portugal, we have a lot of patients with darker skin color, and in these patients it can be a challenge because you cannot see the redness, and you just have to check for increased temperature or pain or any other complaints of patient regarding the wounds. Also, older patients can be a challenge because they don't know how to explain what they feel. And also, I work in a cancer hospital, so for me, this is a big deal. Patients with compromised immune system due to chemotherapy can be a challenge because sometimes they can be significantly ill and they feel nothing. There's no signs of inflammation. The pain is, they are used to have pain, so they don't complain. So they are also a challenge.
Fantastic, thank you. So next question, and what about incision and drainage patients who are sent for dressing change the day after surgery? Okay,
so I know this is common. Sometimes surgeons are very eager to know what's happening to their wounds, and they send patients to go to the incision care the day after. I think we have to really work on knowledge, on make sure everyone knows what we are doing. It's too soon probably to go to incision care the next day. Maybe you should delay it to like 1 week after the surgery. I refer the patients early only when I'm concerned with something. In my hospital, we have great experience with drains. I believe that's the question. We discharge the patients with drains, or nurses or ward nurses explain how the patient and family, what should they care with the drains, and they return about 5 to 6 or 1 week after surgery, not before. And it's safe. We have really nice experience with this approach.
Brilliant, thank you. And just for the record, the fact that you're answering these questions in English, which isn't your main language, is amazing. So thank you for your effort. Would using Would using antibacterial wash prior to procedure help? For example, hair shampoo and shower before surgery?
Yeah, in my hospital, we follow a protocol, and all patients shower previously to surgery with chlorhexidine soap. So it's the thing that it's indicated here in Portugal, and our hospital follows that protocol too.
Brilliant. And question number 6, well, at the moment, maybe our last question. What would you recommend I do on the first signs of dehiscence?
Okay, so this, I really think this is an interesting question. I have 2 different answers. For patients and primary care professionals, I would say just please keep the wound covered and protected to prevent secondary infection. And of course, maybe choose a more absorbent dressing, and also tell to the patient not to exercise too much, because it can make the dehiscence go worse. And now probably the most important response is for the surgeons. You have just to acknowledge the dehiscence and do not try to hide it. Do not ignore it or try to close it again, like many surgeons do. I already tried to do it when I was younger, but I know that that's not the way of doing it, because for sure it will open again. So I would advise to take out the sutures of the dehiscent sites, clean the wounds as soon as possible, debride all the necrotic tissue, skin or subcutaneous tissue, and also if infection is present, drain the pus and start using some local antiseptics. And if it's a big dehiscence, I always consider using negative pressure therapy as soon as possible.
Sarah, thank you.
Thank you.
The last question. So before we carry on, just a massive thank you from me for the presentation, also the questions, and making the efforts you have, not just tonight, but over the last few weeks. Thank you to everyone out there for your questions and for an involvement. The link for the certificate of attendance is now available. So click there, that will count towards your CPD and revalidation. Please go to mymicroworld.online. We've got some fantastic games up there. All the modules are there. Go there now and register. For those of you who will be at UMA next week in Milan, Microworld can be found on the Mernlicher stand. The games can be played, the modules can be seen, and myself and Sarah will be there if you have any questions whatsoever. So Sarah, on behalf of me and the team, thank you. To everyone at Mernlicher, thank you for your continued support. To the teams at Wound Care People, get animated. Thank you for tonight. And finally, to the audience there, to healthcare professionals all around the world, you continue to inspire, you continue to humble us all. Stay safe, stay strong, and we'll see you all very soon. Thank you very much. Good night.
Thank you. Bye.